The prescription opioid epidemic continues to be a public health emergency in America, and leading up to the National Prescription Drug Take-Back Day, Mayo Clinic is taking the pulse on America's health opinions and behaviors to pinpoint what we're doing well as a nation and what needs improvement. Dr. Holly Geyer joins me from Phoenix with the results. Doctor, thanks for joining me.
Thank you for having me, Alex.
So what are some of the key findings about Americans' opinions on opioids and also the alternatives to them?
Well, great question, and thank you so much for giving me the opportunity to talk about this topic. America is facing an epidemic, and this is going to prove to be one of the great challenges in America's history to overcome. The Mayo Clinic performs this national healthcare checkup to really understand the views and the perceptions of the American public on common topics, this one being opioids. We had some rather astounding information come out of it. We've realized through this survey that 90+% of Americans would choose an opioid alternative after a surgical procedure. That's amazing. You know, we assume as providers the vast majority of patients would rather have something stronger than not, and the reality is patients are very interested in options like physical therapy, acupuncture, or even non-pharmacologic options, regular activities, outpatient, walking, exercise. So interesting findings amongst others related to prescribing.
And at what point do Americans see opioid use as a problem? That was also part of the survey, right?
It was. Interestingly enough, despite all the topic discussion out there on the risk of addiction, the risk of overdose, this study identified that 2/3 of Americans don't believe they're at risk for opioid addiction. I wish we could say that the data would support that, but the reality is somewhere between 6 to 12% of all patients that receive an opioid actually run the risk of becoming addicted to it. Opioid overdoses can certainly be a concern as well, and depending on whether or not you have certain risk factors, you can be at higher or lesser risk of developing that.
What a disparity between their perceptions and reality. And then as far as getting rid of opioids, once they're prescribed, again, once the treatment has gone through its course, you've recovered, what's the best way to dispose of them? I know there's a day coming up that's actually meant for that.
There is. Interestingly enough, in this survey, communication ended up being one of the strongest concerns to come out of it. We know that patients and doctors aren't talking. In fact, in this study, we identified 1/3 of patients are actually discussing the role of getting rid of opioids with their provider. It is imperative to keep these things out of the house when you're done with them. Get rid of them. The National Opioid Take-Back Day is one such option to dispense of your opioids, and certainly look up. You can go on national websites like the FDA, NIDA, CDC, all of which might have some information on it. Mayo Clinic's website will as well. Be sure to get rid of these. If you don't have a chance to bring them to a location, dispose of them at home. Mix them with unpalatable substances, dog food, cat food, mother-in-law cooking, whatever it takes. Take the titles off the bottles as well.
That wouldn't work for me. I like my mother-in-law's cooking. So, well, I'm not actually married, but if I did have one, I'd probably pretend I liked it.
You're a lucky man.
Doctor, thanks so much for your time this morning.
Thank you.
Stay where you are. We'll be right back.